delighted to be here, really enjoying this morning's sessions and the panel we've just heard now. So I'm going to speak a little bit about Ireland's Wellbeing Framework, which I think resonates with a lot of the perspectives we've heard so far today. Just briefly on the NESC, we're the national advisory body to the Taoiseach and the Irish government. So we provide research, dialogue and advice that helps to achieve Ireland's sustainable economic, social and environmental development. So on wellbeing, I suppose wellbeing frameworks as a specific approach have been increasingly developed since around 2008 as a way of, moving beyond an idea of purely economic measures such as GDP as being, this was the measure of progress. NESC's first report in this area was back in 2009, where colleagues had developed Wellbeing Matters, a social report for Ireland. But then much more recently in 2021, following a commitment in the programme for government to develop a wellbeing framework for Ireland, NESC undertook a stakeholder consultation to help inform the development of that framework. A key message coming out of that consultation was the importance of focusing on equity, as we've just heard, and NESC was then subsequently requested to produce advice exploring the role of wellbeing frameworks, specifically in relation to inequality, and that report was published in 2023. So what are wellbeing frameworks? So there's a wide variety in how individual countries have approached wellbeing frameworks, and I suppose to some degree the Sustainable Development Goals can be seen as an expression of such a framework in a global context. But typically, wellbeing framework contains the following elements up there on the slide. So national goals that move beyond the purely economic, public consultation being really critical to help develop these goals, a dashboard of indicators to measure performance, regular publication of such performance reports, application to the national budget is a frequent feature, as are sort of new ways of working. So in 2021, as I mentioned, following that commitment in the programme for government, NESC was requested to engage stakeholder consultation on the development of Ireland's framework. So government had decided that the OECD's wellbeing framework would be a starting point. The OECD framework has 11 dimensions of framework, and NESC was asked, to sense check these kind of dimensions with people across Ireland, seeing how they align with our priorities, the specifics of what the dimensions might involve, where there will be gaps and so on. So one of the features of that consultation was a survey conducted with 539 organisations representing social, economic and environmental pillars or organisations working in those areas, as well as about 125 organisations working with or representing different population groups related to, for example, youth or older people, disability, gender, ethnic group, faith, that rural and regional perspective, and then different socio-economic groups. So key messages, were that all 11 dimensions of wellbeing really resonated strongly. The survey had asked people to rank those measures or those dimensions from not at all important to very important, and all 11 were ranked as either very important or important, I think reflecting that really multi-dimensional nature of well-being. The most highly rated ones were health, possibly not surprisingly given, the timing of that on the heels of the pandemic, followed by environment, with housing being the third highest ranked in an Irish context. Interestingly, income and wealth were ranked the lowest, with other areas such as work-life balance, social connectedness, subjective well-being falling in the middle. So the Irish Wellbeing Framework has 11 dimensions of well-being and an accompanying dashboard of 35 indicators to measure well-being in Ireland across these 11 dimensions. And I suppose just circled, so this is the graphic from the Wellbeing Framework, and circled in red, are three areas maybe that we've been discussing today. So in terms of the health dimension, this is defined as the capacity of an individual to be and feel well with good mental and physical health, living a life unencumbered by illness, and collectively the good mental and physical health of the population also contributes to future well-being. And I think just in terms of what came up during the consultation, while health was included in the OECD framework, respondents to the wider survey, I guess, provided more nuance, I guess, on which aspects they felt were important. And these included the strength of the health system, equal access to services and waiting times. And a really strong message was the need to ring-fence mental health indicators and give them their own identity, I guess, within the framework. And this was subsequently reflected in Ireland's framework by the health dimension being specifically mental and physical health to give, I guess, profile and prominence to the issue of mental health specifically. In relation to the environment dimension, this is environment, climate and biodiversity. And as I mentioned before, this was the second highest ranked dimension after health in our work. And an issue that did come up strongly, and I've heard it, I guess, a few times today, was the importance of green space and access to nature. People felt that there really should be, positive indicators reflected in such a framework, alongside maybe some of the more negative areas such as pollution, greenhouse gas emissions, and so on. And I suppose just to reflect that this is, I suppose it remains a gap in the Wellbeing Framework, which currently has indicators on pollution, water quality, greenhouse gases and waste. But I guess that sort of sense of people's access to nature isn't currently one that's reflected. Then in terms of equality and sustainability, it wraps around the whole framework. These are two key themes that came up in the public consultation. The first question in our survey had asked people, I guess, to articulate a bit of a vision for Ireland, to complete the sentence, "I want an Ireland where ... And just going back to that slide, the image there is a word cloud of the responses that came from, I guess, that open question, and issues around, and you'll see equality, health, but access also came up really, really strongly here. So from 2023 on, reporting around the Wellbeing Framework includes specifically a measure of equality given across the 11 dimensions, or each of the indicators under the 11 dimensions, which allows for the assessment of each dimension from an equality perspective. So to give a bit of a flavour of those, I mean, the first report for a Wellbeing Framework for Ireland was in 2021, and this really outlines the vision, the framework, how it might be integrated into policy, and maybe a roadmap for further stages, because it was seen as beginning to embark on it. It's a process that will evolve over time. The second report was 2021, and this was the second report of the Wellbeing Framework, not so much a report on the indicators and progress, but more about refining the framework, how it relates to international and local linkages. So, for example, the Sustainable Development Goals from an international context, as well as more locally. A lot of the PPNs have developed wellbeing visions and frameworks, and again, a focus on how it be embedded and implemented. But then there have been two annual reports then on the actual reporting on the dashboard of indicators. So the 2022 report indicated that 20 out of the 35 indicators were performing well, with 6 negative and 9 more mixed. And then the 2023 report, again, 10 out of the 11 dimensions broadly performing well. But here is where it also introduced this specific figure for equality across indicators. So maybe the particular themes that we were interested in, so the mental and physical health. 2022 report had overall mixed figure for mental and physical health dimension, with some positive trends for physical health, but also evidence of unmet need for medical examination. While the 2023 report spoke of an overall positive performance in relation to average healthy life years. There was the indicator around mental health, so 14% of the population reported experiencing depression for the report for 2019, which is the latest data, which had no trend internationally to compare data for that indicator, and 2% of the population reported unmet need for medical care in 2021, which was down slightly from the 2.5% for the previous reported year of 2016. And this was considered to be around the same as EU average. In relation to the environment, this was the only overall negative dimension from the 2022 and subsequently 2023 reports, with the proportion of people reporting experiencing pollution, grime or other environmental problems increasing in 2019 compared to 2014. Greenhouse gas emissions also increasing in the comparable years here of 2014 to 2019. 2023, again, negative performance across all the 4 indicators of this dimension, with waste generation here in particular increasing and being above the EU average. So I think maybe the possibly interesting most interesting aspect of the 2023 report was this focus on equality across the different dimensions. So the examination of the data from that report, the 2023 report, had highlighted that there were several groups who experience inequality across a high proportion of the indicators. And the kind of groupings are women, single parent households, people living alone, people living as immigrants into Ireland, unemployed people, households with lower incomes, households in rental accommodation, and people with a long-term illness or disability. So possibly no surprises there for anyone in relation to that list. But of the 11 dimensions, 2 showed, I suppose, particularly large differences between groups, and these were housing and the built environment and income and wealth. And then the dimensions, I guess, that showed sort of smaller differences between groups included civic engagement, trust and cultural expressions, and interestingly, subjective well-being. So this, I guess, just gives a visual snapshot of that 2023 report, with the white bar being, I guess, performance on the indicators, the green bar being where there's a sort of long-term sustainability aspect to the indicators, and then the blue being in relation to inequality. So I guess for mental and physical health, which is the second bar in, showing, I suppose, positive but relatively modest progress and long-term sustainability, but quite high relative to the others, equality on the dimension. So it'd be interesting to explore that a little bit further. Where for environment and biodiversity, which is just past the middle there, you can see it's the only one with negative performance across the whole dimension, negative long-term sustainability, but then relatively high equality. And as we mentioned, the really low measure for equality across the indicators is that one, again, close to the middle, housing and the built environment. Okay, so that's just to give a little bit of a sense of the wellbeing framework itself. But I guess what we're maybe reflecting on a little bit, I guess, is the role of wellbeing frameworks, and I suppose how they help us, I guess, address any of this. So the Irish Wellbeing Framework is relatively new. It is, I guess, still under a process of evolution. And the picture given in the dashboard, I guess, reflects, the choice of indicators that have been chosen. So across the 11 dimensions, there's 35 indicators, which is only about 3 per dimension. So I guess, we're telling a very specific picture in the framework. And a key message then from the consultation report, as I mentioned, was that idea of equality, which has come out quite strongly, but also that, I guess, data and reporting alone are going to be insufficient for changing outcomes. How the framework is used in policy and in practice is key. And so the 2023 report from NESP that focused on inequality specifically in wellbeing frameworks, I suppose, highlighted maybe a number of opportunities. So the first is that, I guess, Ireland's wellbeing framework is already, I suppose, attempting to bring new information into the policy space that might help shape policy development and practice. The second is that wellbeing frameworks offer an opportunity to make environmental justice more explicit, but that this would need further development. I think we've already heard today how maybe low socioeconomic position can be associated with increased exposure to pollution and poorer access to blue and green outdoor spaces. But the data currently available on environmental issues is often not sufficient of breadth and depth to prioritise and refine environmental wellbeing outcomes, and this really needs to be addressed. The third is that wellbeing frameworks can highlight key data gaps that need to be addressed by new activities and resources. And so while the frameworks stress the importance of collecting new data, the availability of data is often fragmented, possibly too small scale, or not available, particularly for specific groups affected by inequality. So again, an area that really needs addressing. The fourth opportunity is that wellbeing frameworks can help develop new ways of working that have the potential to help address inequalities. So some processes are processes are being established under the Irish Wellbeing Framework to incorporate wellbeing dimensions, for example, into budget analysis. The fifth area of opportunity is that importance of stakeholder engagement, citizen engagement, enhanced dialogue within wellbeing frameworks, which have the potential to address inequalities. I'm really conscious of time in my 20 seconds. The sixth is that wellbeing frameworks have the potential to integrate a range of policy work that can happen at different levels of government. The seventh is the focus on key inequality goals can be supported by working towards and monitoring more specific targets. So, for example, some countries have agreed national wellbeing goals with specific dates by which goals must be met, so target setting. So, for example, in Wales, the gap in health life expectancy between the least and most deprived has a target to be narrowed by 15% by 2050. And so the existence of these such goals can help focus policy work on reaching them, particularly when we're looking at that cross-departmental, with that whole of government approach, if these are whole of government targets. And finally, reflecting from international experience, is that incorporating both hard and soft tools might have longer lasting impact on well-being and inequality. So we see the experience of active implementation of wellbeing frameworks in some countries suggests that harder tools, which might include legislative underpinning or independent accountability mechanisms for the frameworks, can really support those softer tools, such as measurement, reporting, and consensus building. And this would suggest that a mix of both approaches is really useful for the long-term implementation of wellbeing goals. Thank you very much.